welcome back. I am your host, Jessica Taylor of the OffScript Podcast and cast member of Ready to Love Dallas Season 8. But today's episode, I am so excited because I am so fortunate and so blessed to be able to do this episode with you guys, with two of my favorite people, Dr. Wendy Parnell and Dr. Tiffany Jones, who are some amazing women that support me and have been supporting me in the past couple of years. And we're going to talk a little bit about that. So this episode, unlike our previous episodes, we will not be digging deep down into what happened on Ready to Love or anything like that. But this episode, we're really going to kind of focus on some of the things that we were not able to discuss on the show, and also the effects that it has as we think about Black women and maternal health. So joining me on this episode, Dr. Wendy Parnell.
Hi.
And Dr. Tiffany Jones. Dr. Wendy Parnell, OBGYN, she is my OBGYN, to be very clear. She's mine. And then Dr. Tiffany Jones, who is also my fertility doctor. And I'm just going to give a round of applause. I'm just so glad that y'all are here today and that you're joining us on this episode. So without further ado, I want to give Dr. Jones and Dr. Parnell the quick opportunity to introduce themselves, let you know how they got into the field, and then we're going to dig into some of these questions that we prepared as we discuss this recent experience as I had with egg retrieval.
Good to see you, Jessica.
Yes, Pumpkin.
So, Wendy Parnell, I'm an OBGYN from Dallas, Texas originally, and I practice here. I've been in private practice at Carlos and Parnell for the last 12 years. It goes quickly, but been in practice for 12 years and have truly enjoyed it. I've loved the experience of the continuity of care with patients, trying to keep people well, but also educate patients in terms of important issues such as our fertility and our egg health and our overall general health and wellness. So that's been a great journey. The blessing of my practice is it was started by my father, my godfather, over 40 years ago. And it's just truly a blessing to have been able to practice with them, as well as just to continue the legacy and the foundation that they laid for our group.
And you're still here and still practicing.
Yeah.
And it's amazing. It's amazing.
Yeah.
And Dr. Jones.
Hi, I'm Dr. Tiffany Jones. I am a board-certified OBGYN and board-certified reproductive endocrinology and infertility specialist. I practice at Conceive Fertility Center in Dallas, Texas, and I'm originally from Los Angeles. I did my training at the Mayo Clinic for fertility. I've been in practice for 5 years. Our practice is only 5 years old, so I was able to join a newly growing group with Dr. Julian Escobar and Derek Haas, and we love taking care of our patients. I have a particular passion for fertility preservation, especially because I feel like so many of us are chasing our careers, our education, finding love later, and we shouldn't have to sacrifice our family and our family goals at the expense of other things.
Yeah, I think that's so great. And that's a perfect segue into one of the questions that we're going to talk about too, in terms of, growing your career and then also wanting to chase your personal dreams, but still having in this back of mind, I still want to be a mother. I still want to have children. I still want to do these things, and wanting to do some of them a little later after you've achieved some things. I know with my mom, I was very clear. She said, make sure you've done everything that you wanted to do before you have kids, because they're not like puppies. You can take them and say, oh, I'm tired of this. I want to go back and start over. And so I took heed to that because my mom had me and my sister later, right? But I saw the difference in our experiences versus others because she was like, this is something I'm ready to do, was completely devoted to that. So I'll start with you, Dr. Tiffany. Just speaking a little bit about that balance of maintaining career and love. Both of you all are recently engaged, and just understanding what that's looked like for you thus far.
Yeah, so my personal experience is just a little different. So I was actually a product of a teenage mom. So she had me when she was just 18, and seeing her through her life, the goals she had for me and how she reared me and my sister were really, like your mom said, try to achieve everything you want before you, start off on this journey. But this journey takes years.
Yeah.
To be a physician, I mean, Wendy, it's a long time, okay?
And then you're board certified, so that's even more.
It's a long time. And, like any career that you're going into, you're going to invest your best reproductive years, which are your 20s, right?
Yeah.
And, I was in the club and I was in school in my 20s,
right.
making memories.
Yeah.
Right?
Yeah.
And so, you look back and you graduate, you get everything that you want, and now you're maybe not in your reproductive prime. Hormone levels start to change, like AMH, it started off real high, real nice, real promising, and then they do a test and it's like, oh wait, what's this? And then you start to hear that 35 advanced maternal age or geriatric pregnancies, and everything just starts crashing down. I actually don't have children and I may not have children. But if I wanted the option, freezing eggs would have helped me to achieve that type of goal without sacrificing everything that I wanted to accomplish.
Yeah.
And I am not engaged. I have a Stedman, okay? So I'm an Oprah and he's my Stedman. Okay?
I like it.
But Stedman needed to give me a little bling, okay?
Listen.
Dr. Parnell is all the way engaged. So we're going to let her talk about that part.
And I think, to be honest, that's even something within itself too, right? Because what's wrong with that?
Nothing.
There's nothing wrong with it. But I think in relationships, and even me doing this experiment on the show, is finding what works for you and making sure that it works for your household. I think a lot of times we're trying so hard to fit the mold of what was presented, like you must do this and you must do it this way.
In that order.
Yeah, but most importantly, are you happy? And is your partner happy? Because those are the only two people that matter within this particular space. And that was even something that I've been noticing with some of my other friends. Some of them are choosing to have the children first and then getting married thereafter. And it works for them, and I think that is very important, is to understand that. And I have another friend who's in the same thing. And so she is her Oprah Stedman. She says the same thing. They're in the very same. And funny enough, they have an agreement that they just kind of work through, and it works for them, And I think the more people, when we start exploring that, we'll start to see better outcomes in situations, than what we've been seeing thus far.
Yeah. The pathway to relationships, the pathway to motherhood, there's no script for it, So, whatever works for one's relationship. I've got plenty of patients that aren't in relationships, but still have a very strong desire to be mothers. I have a physician colleague who didn't have a partner, but definitely heard a calling on her life to be a mother, and now has 2 beautiful children. So I think, releasing that piece of, I can't be a mother unless I have this. I think that's really important to honor and recognize too. But I think your point of how much time we spend on our path and our careers can be very consuming. But when I talk to younger ladies who are maybe interested in going into the medical field, I always encourage them, live your life along the way. Like, don't put your head in the sand. And I think I maybe was a little bit misled in that way, because it was always, when you get to this point, it'll come later. And so to your point, you're missing that window of time when there are other, professionals or other, grad students that are in your environment that you're just kind of like, oh no, I'm in med school. I got to study. I'm in residency. I've got to get to work for my, 80 hours this week. And you just kind of miss everything. And I look up when I was 30 and I'm like, okay, I'm ready. Like, let's
now it's time for the club.
So, and it's like, it's just a different stage. And so for me, I'm just thankful and blessed that my fiance, we were able to be introduced, and it's definitely a really good thing. And he definitely was one that was very career driven as well. So I think it was all in the right timing, but it definitely can just be different than what you anticipate. I did freeze my eggs at 37. And so I kind of use that as a gauge between 35 and 37 when I'm talking to patients, to just start being mindful, not to suggest that you want to or that you can, but just know that this is not going to be something that we can look up like some of the celebrities that you see them, you don't see their journey, you don't know what they did to get there, you don't know if those are even their eggs. And so I think just having that realistic conversation, so at least people can say, I know and I've heard this information, and what they choose to do with it is completely, their choice.
Yeah. I remember when I came to your office one time, in addition to Wendy being an amazing OBGYN, she's also my sounding board when I come with all these theories of things that I've read on WebMD. And she's like, girl, get off the internet. Like,
Google will be the death of us.
Get off the internet. And I'm like, oh my God, it's the big one. I'm going. She was like, girl, it's not that deep. But I remember that one conversation. I came in, I was fresh off of a breakup, and I'm going into my later 30s. And I'm like, what about, did God forget about me? Like, is it not going to happen for me? I'm past what I thought was going to be my prime. I thought I was going to be married with kids by now. And not only is it not happening, I don't even see anything within my immediate space that will actually make me think that he's still here and that he's still covering me or whatever. And Wendy said, girl, you're fine. Like, I'm hoping how much you're fine. She said, but have you thought about egg freezing? And we start talking about it. And I start talking to you about, this process. And for me, the only time I heard about egg freezing was on Basketball Wives when Evelyn Lozada was talking about it, right? Yeah. And for me, that seemed celebrity, like you mentioned, celebrity, affluence, out of my reach of things that I'm even able to consider, even think about. And then too, I was super religious and my family is super, in faith, and you don't need to do that. Just trust God. He'll see you through. I'm like, and God made doctors too. Like, when there can be some balance there, right? But it really took me some time to even come to the agreement of saying, I'll think about it. And I think I was like 36 when I came in around that time. So now I'm 38. And so I was like, okay, I'm going to do it here. And then I stop. And so I was just going to say, I'll tell you, thank you. But just even having that conversation, because a lot of people aren't having it, particularly around Black women. So I was going to ask you, what are some ways you think we might be able to have this conversation, not only more often, but also sooner, to start thinking about it? Because it's not a cheap process. It's not $5. So it was really something I had to not only think about, but also financially prepare for as well.
And I think that's the key, is just planting that seed early. So, I never want to be premature with a conversation. Yeah. So sometimes, I'll have a 28-year-old comes like, do you think I should freeze my eggs? I'm like, girl, no, I think you should just go enjoy your life.
Yeah.
But I definitely think, like, as we get into those early mid 30s, to at least have the conversation. It's not a pressure thing. So I think that also adds a lot of stress and anxiety to our lives, to feel like, oh, am I infertile? Because now there's this culture of like, I have to prove to you that you're fertile versus you just messing around and finding out. Like, most people are fertile. The majority of people are fertile. And so that's the downside of sometimes social media putting this big push towards infertility. But I think having that conversation, being realistic, laying the numbers out. I always encourage patients now to check with their insurance, because some plans are starting to offer fertility benefits. Sometimes maybe picking a different plan next year that maybe it's $100 more per month. But when you roll that out over the course of 12 months, it's still less than what, Dr. Jones's fees are. And it's not her fees. It's really the medicines that are so expensive.
Yeah, and absolutely.
So just making sure you know your benefits and are picking the right plan for you, if that's something that you feel you want to go on that journey, that path.
Yeah. So I've had patients take jobs at Starbucks, Walmart, Target. Like, there are a lot of companies that offer fertility insurances. There are insurances that are solely fertility benefits, like Progeny and Carrot and Kindbody. So it is very important for us to know that, one, this is not an affluent thing.
Yeah.
Many people freeze eggs. Many people do IVF or fertility treatments, and it is getting more and more accessible. But no, it is not free, and it is still expensive, but it's not Janet Jackson expensive, right?
Right.
Like, nobody has that.
Yeah.
And talking about it, when you say, well, how do we introduce these conversations? My favorite conversations are at brunch with my girlfriends, right? And some people go through things and you talk about it at brunch with those mimosas. I don't drink, but I like watching people drink those mimosas.
Oh.
And, you start talking about those things. You start talking about your aspirations. Usually your friend groups are in similar ages, and these are the conversations that should evolve with people. Just kind of knowing where you're going and what your desires are. And somebody mentions, hey, have you thought about this? I think that's how we move the needle forward, and making sure that more people understand what they can do.
Important. So I know we were talking a little bit earlier about social media and infertility. So I wanted to kind of go back to that to see if there was anything else you wanted to add on, because it's something we're seeing more often. And so I just wanted to maybe have you expound on that piece a little bit.
Absolutely. I recognize that social media is here to stay, as much as I would like to, block it as soon as you walk in my office doors. It just completely shuts down and escapes your brain, but I can't. And so, recognizing and just encouraging patients to be mindful of what and where you get that information, what you allow to consume as the truth, because a lot of it can be confusing. It's confusing enough with just the facts in terms of interpreting different types of infertility, interpreting hormone levels, because the hormone level is not the end all be all. But if you leave it up to social media, they make you think, oh, if I have a good AMH and I'm fertile and I can keep living my best life, and I can look back at this in a few years. But there's so many different elements just to that. It's just a number, so just being able to put it into perspective, I think is really important. And so bringing that little piece of like, oh, I saw this on social media, and then using that for a bigger conversation, because it's not just about
one hormone level. It's not just about your age. It's, lifestyle, your diet, your nutrition, weight management. There's so many elements that go into fertility, but social media, it's strong in its hold on and its influence, and the people that can get on there and say anything and everything. It really is powerful. And so as physicians, there's not enough of us to combat all the different influencers that are on social media. So we can try, but it's a very strong power that's out there that we try to do our best, one patient at a time, to kind of undo.
It's so funny. There's this one, she's on Twitter, and this was during the pandemic. And she's an African-American woman, and she doesn't necessarily believe in modern medicine, right? She's an herbalist, and she's on those things. And so there's this girl on Twitter, and she's asking her questions, and her doctor had finally got her an appointment. I want to say, I can't remember exactly. It was a specialist, though. Long as I say that, she got her doctor was able to get her an appointment with a specialist to look at her case, and she had been turned down several times. And so she came into the conversation all excited, talking about, well, my doctor got me this appointment. I'm gonna go see this specialist. By the end of that conversation, she was now deciding that she was going to cancel the appointment with the specialist and participate in some of the holistic things that this lady on Twitter was telling her about. And it was so concerning to me, because if you're not careful how people present things, it can make it seem as if it's factual, right? But I was sitting there looking like, no, go to your doctor, go to this appointment, right? But it made me also think too about the amount of people just putting out false information, because guess what? This lady's also not a doctor, and she's also not a licensed herbalist. Like, this is just something that she does in her kitchen, and it healed her, so it should heal you too, right?
I think that's the key, is just being careful, because there's some benefits to, holistic approaches to different conditions. So not to knock or minimize that there couldn't be some benefit.
Yeah.
I'm one to, get all
Both
of
of
the
them.
information, and see what's going to be the best fit for your body, what's going to be, the best way to implement these changes. Because I think sometimes they can very much complement each other. But I think sometimes just exclusively looking at, one path can be, damaging, and maybe you're losing time when you could be, working up other pathways. If you're 49, you probably should have seen Dr. Jones by now in terms of talking about donor eggs, so the herbalist may not be the only path that you need to be pursuing at that time. Can that be helpful to make for a healthy pregnancy after you've met with Dr. Jones? She's talked to you through the options. Absolutely, but not exclusively the only way that you need to be.
And I think that's important too. So what I appreciate about the both of you all is that just always talk to Dr. Jones, talk to Dr. Parnell. What do they say? Because it's not just information, but the amount of information. So then I can take it, I can formulate my own opinions. Okay, this is what I want to do. This is what I don't want to do. This is when I want to start it. This is where I don't want to start it. And I think the importance of having those open conversations with your doctors and with your practitioners, even if you hear something crazy on the internet or you read something, is beneficial, because you can say, you know what, I'm going to take this and use it, or maybe this doesn't necessarily fit, right? But it's understanding the information is there and it's valid and it's coming from a credible source too. I think it's something else we got to think about.
Yeah. I think that Instagram, TikTok, all those things have great roles, and then they have really, harmful roles as far as the amount of fear mongering. I know that when I look at dog videos, and everything on my feed is dog videos.
Yep.
And so also being a fertility specialist, you would think that everyone has infertility, because that's kind of what you're looking at. But it's not the case. I do try to make sure that people who are coming in, especially when they're trying to freeze their eggs, that they know that just because they're walking into my clinic that says, fertility, that they don't leave thinking that now they're infertile because they've done this process or because they've seen me, really empowering them that women get pregnant almost at any age, except for after menopause.
Yeah.
But it does become more prevalent as we get older. So not instilling fear, but really arming people with the knowledge and the power to make decisions for themselves, and having information to make informed decisions is really, really important. But, I think that on Instagram, people share their stories. So it is very I learned so many things from other people. So it is helpful, but their story is not necessarily going to be my story. And that's where people get so mixed up.
Oh, that's a great point. I think to your point, it's almost like they personalize it, right? Like, I heard your personal story, and me and you are similar. We look similar, same age. So this is probably going to be the same thing for me as well, too. That is very important. Go ahead.
The same thing happens in pregnancy. You know, everyone wants to tell you their horror story about their delivery and like, oh my gosh, now I'm going to have this. And it's, I'm like, you've had a healthy pregnancy. Like, what do you mean? Like, you're doing great. Like, yes, if it changes, we'll adapt with that change, but you're doing fantastic. You know, so just recognizing that every fertility journey, every pregnancy, even a pregnancy within the same body can be so different, you know, so you can't even compare it to your first pregnancy, much less to somebody else's completely. So just taking it as a story and not as the gospel. And this is how, you know, fertility journeys go for everyone. But I wanted to mention to your point earlier about our collaboration. We collaborate a lot. We have a lot of mutual patients. There's oftentimes where, you know, Tiffany will be doing her evaluation and say, hey, I think this patient needs this. I'm going to send her back to you for this. Or I've gotten to the point of doing everything I can in my office. Hey, I'm going to refer you on to Dr. Jones and she's going to take it from here. And then that patient bounces back after she's pregnant. So there definitely is an importance to having providers that are able to collaborate well together because, you know, it's a team. You know, when you're along this journey, it's not just your OB, it's not just your fertility specialist. You really want them to be able to pick up the phone, communicate, and talk your case through because every case can be so different.
Yeah. And then also having, I feel like I enjoy it too, also having you guys have a rapport with each other and then rapport with patients too, right? And so being able to communicate what the patient is really looking for, what they're asking for is also something that's very helpful because Dr. Parnell referred me to Dr. Jones. And so that's why I was like, oh, okay. Because I was very particular. I want a Black woman. Like I want a Black woman because I was telling people earlier, growing up in Atlanta, I had my first white doctor when I went to college. But I know that that's not the case for a lot of my other friends, right? My friends are like, I ain't never have a Black doctor. I'm like, well, where you live? Like, what?
Not in Los Angeles.
Yeah.
I didn't even have a Black person training me.
Wow.
You know, like
Really?
It's very different. Yeah.
Yeah. And so for me, it was complete opposite. And then I spent most of my time in Morehouse campus. So I'm always there. And so when I got out, I was like, I wanted to be very intentional in finding that and also being able to just, when I go to the doctor and just really be able to say what's going on and what I'm feeling and what I'm concerned about. And so as I think that's a beautiful thing of having a group of people and also your physicians who have an understanding of your cases and also communicating with each other as well.
I feel we're blessed and fortunate because we have Dr. Jones in Dallas and there's a lot of cities, a lot of metroplexes, not just a Black REI, but a talented, amazing, smart, intelligent REI because that's number one. Because I'm not going to refer my patients to someone. And you know, it's just because I care about my patients enough. I'm not going to refer them to someone just because of their skin color. If I can say that she is, you know, the best REI in the area and she happens to be Black, then that's going to always be my pathway if I'm looking at two. But I don't feel like I'm referring my patients to a lesser by sending her because I know they want a Black female, or if I feel like, you know, I send all of my patients, you know, get referrals to Dr. Jones because she's a good REI. Her group is a great group of REIs. And so I think that's what we also must always consider is the quality of the care that we're getting, no matter what the skin color.
Absolutely.
I mean, we just want good quality of care, especially when we go into that space of maternal mortality. You know, you want someone who's going to take good care of you, who you have a good rapport with, who's going to listen to you. And if that happens to be a Black provider, fantastic. But quality of care should always be the number one thing that we're seeking.
Yeah. And I think being Black providers, though, I think that weight also is on our shoulders. Like, I must be at my best. I'm the only here, right? And so it is a tremendous, you know, I'm not going to use the word burden. Like it is just, you know, like by God's grace, giving me this opportunity. And being a Black woman physician, a lot of people do want a provider that understands some of the nuances. When I was in residency, I was called to a room for a psych eval because a patient was cutting their hair. She had braids. The nurse didn't understand that was not her hair, you know, and so there are things that really, you know, like you miss by not understanding, just like the basics that we were raised in, but being the best that I can be, I must be that for my patients. Like we must be that for our patients, because if you go somewhere else, it may not be that way. And people can just lean on, oh, well, they're going to refer to me anyway, because I'm the only one. It's like, no, I have to be there and I have to be that for them, because so many other times they've been let down by someone else that I can't fail them.
Yeah. So we're going to take a quick commercial break right here, and we will come back in a few minutes. As right now, I'm still sitting with Dr. Wendy Parnell and Dr. Tiffany Jones, and I am your host, Jessica Taylor from the OffScript Podcast. back. Welcome back to the OffScript Podcast. I'm your host, Jessica Taylor, and I am joined here today with Dr. Wendy Parnell and Dr. Tiffany Jones, and we are discussing egg retrievals and maternal health as it relates to Black women and within our particular community. So, Dr. Jones, I'm coming back to you. We've been talking about egg retrieval, but I wanted to know, what is probably the best age to start the process? And then what does the process look like in its totality? Like, after you decided you're going to go and do it, you've got your money together, you've got your mental ready, what does that process actually look like?
It's very good points that you mentioned about getting your mental ready, because it is a journey. Our Society for Reproductive Medicine doesn't have specific ages set in stone for when someone should freeze their eggs. But I like to extrapolate from people who donate eggs. So we wouldn't have you donate eggs before the age of 21.
Okay.
But to Dr. Parnell's point, that's really early. Like, you don't even know where you're going, okay? And
Yeah.
so it might be a big investment for you and not a lot of return on the investment if you never need those eggs. I definitely think once you get into your late 20s, 30s, mid 30s, it should become more of a conversation about where your life is going. Eggs are best earlier, okay? And there's just, that's the end point, okay? If any calculator that I use to say what these eggs can do for you, the age is really the only factor that it's going to look at, because our fertility potential is best as we're younger. But if you're 25 and you get married at 26 and you have your babies at 28, you're not going to use those eggs, right?
Right.
If you're 34, that's really like, if you're single at 34, I would say that's a great age, because you're not 35 yet. So those calculations don't quite take a big dip. So for instance, if I froze at 34, 15 eggs, you probably have a 70 to 80% chance of having one live birth from those eggs.
Wow. Out of
35?
15?
Out of 15, okay?
Wow.
So it's not one egg make one baby, okay?
Yeah.
It's the one right egg makes one baby. And once you hit 35, 36, 37, those rates go down. Where at 39, 15 eggs is less than a 50% chance. And if you're going to make that type of investment, I at least want a coin toss, if I'm going to spend that kind of coin on doing it. So I definitely think that conversation starts in your late 20s. Maybe you don't move forward, but I think getting testing like that AMH level, which comes from our ovaries and kind of tells us what our ovarian reserve or how many eggs we have in the basket, starting getting those tests around that age, at least you have a point. And then you do it at 30 and did it change? Is it the same? If it's the same, you may feel more comfortable to just kind of keep going and see where life takes you. But if you get to 34 and you're still not, ready to have a child, whether you have a partner or not, think about freezing your eggs. After 39, it gets a little dicey. I don't have an age cutoff for my patients. I always do their testing. I always do the calculation, and we always talk about it, because maybe it's a better option than nothing. But when you go to unfreeze eggs or to thaw them, if you don't get a child from that, I don't want a patient not to understand that process from the beginning, right? You have to understand it's not a guarantee. To make it a better option and have higher success rates, you really want to try to do it as young as reasonably possible. The process takes about 2 weeks to do, okay? It's a lot of injections. I personally have a needle phobia, so that's just like, I'm waiting for a pill. It's probably not coming, but yeah, you have to take injections 2 to 3 times a day for about 2 weeks. And during that 2-week time, you have to come into clinic to get ultrasounds and blood work. So it's quite intrusive into someone's normal schedule. But once you do that and then you move forward with the egg retrieval, you're done. The eggs are frozen, and they can be frozen forever. We've been freezing eggs probably for the last 15 years out of an experimental category. Before that, they had been doing it, but it was labeled experimental. The egg retrieval process takes only about 5 minutes to do.
Wow.
You go to sleep. So that doesn't take 5 minutes because the anesthesiologist, they got to do their thing. But for me to take the eggs out, it really takes about 5 minutes. It's done through an ultrasound. There's a needle, and we just drain the follicles that have the eggs and give them to an embryologist, and they find the eggs and they freeze them. You go home same day after waiting in the recovery for maybe 30 minutes, and most people can go to work the next day or the day after.
So I want to go back. You mentioned AMH. We've heard that a couple times. What does that stand for, and why is that important?
So AMH stands for anti-Mullerian hormone, and it is a hormone that is made specifically from the cells that support our eggs. So the higher that number is, the better, the more eggs you have at a particular time in your life. It does decrease with age. And so when I get it, and I know I have a patient who may be a little bit older, I prepare them for that. But the most important thing I empower them is that it does not predict who can get pregnant, right? They did a study of thousands of women. They had AMHs across the board. Some women with low AMHs were pregnant without any difficulty, and some with high AMHs couldn't get pregnant. So it can't be extrapolated in that, but it does tell me how someone's going to respond to the fertility medications. So that's how I use it. So if someone has an AMH of 3, they're doing quite well. If someone has an AMH of 0.9, it's lower, but does it mean that they're not going to get pregnant? No. And so I try to get that before we even get it. Like, I don't want you jumping off the ledge. I don't want you coming out here crying, because I've had patients that were sitting on my couch referred to me by another physician, not Dr. Parnell, because she that were like, oh, your AMH is low. They were already pregnant on the couch,
Oh, no.
Yeah. And so that's the thing about the fear mongering, right? We can get these tests, but you also have to know how to use them, how to interpret them, and not let it hold you hostage, right? You can be empowered to say, okay, my AMH is lower. Maybe I use that to make my decisions. Maybe I don't wait 5 more years to have my children as I had planned. But not to say, like, I'm going to go into a deep depression because I'll never be a mom. If that is what we're going to do with the test, then it's probably better not to ever get it, because it's going to mess with you in a way that it's not supposed to.
Now, I got a quick question, because you were talking about getting the AMH testing. Is that something I can do with my OBGYN, or is that something I always need to do with a fertility doctor?
No, you can do it with your OBGYN. You can even do it by yourself. There are companies that you just do a finger stick, you mail it off. Modern Fertility is one of them. And they have a on-site MD that can walk you through what yours mean, and they mail you your results. And I think that it kind of puts it into your hands. But again, if you're not really comfortable with what that information means, it could be a double-edged sword, because a low result might make someone feel a way that they shouldn't.
Right.
Because they may stop birth control pill. Then they wonder why they have a baby, because, I thought my AMH was low. I thought I was infertile. That's not true.
That's a good point. And so the other thing I wanted to go back to too, as you said, 1 egg out of 15 that you harvested. So can we just kind of dig a little deeper? Because even my ignorance thought that if I gave you this many eggs, then you should be able to pull out at least these many possible healthy babies, right? Or healthy eggs to make a baby. How do you come to that probability?
So they had to do studies. So they looked at studies of women who froze their eggs and used them at different ages. And these were the average numbers of normal embryos or live births from that cohort of eggs. So the younger someone is, and again, there are women who graciously donate their eggs, and they do it at a very young age. Those eggs usually convert very highly to normal, healthy embryos that will go on to be live births. But the older we get, that's why fertility rates decrease. So at your 20s, you probably have a 25% chance every month of getting pregnant. At 16, you blink. And I was just in the hot tub. I don't know what happened.
Yeah.
Okay. But, you don't go to a lot of baby showers at 40, at 42, at 44. And it's not that people can't get pregnant. Some women do, but the success rates are almost 1% a month. So it's very different, because the quality of each egg that is released every month is lower. So it doesn't make a great embryo. It doesn't go on to a live birth. Miscarriage rates go up because of that. Now, unfortunately, or fortunately, because I'm just not that gender, men like Al Pacino can have babies at 80. Okay. So we know the eggs are cracking. Okay. They crack. The sperm, it's just reproductively, it's very different. Men actually make new sperm every second of every day, where we're born with every egg we're ever going to have. While we're in our own mothers, our eggs are there. And as we age, they develop abnormalities. And so the success rates using those eggs become lower and lower.
I didn't know that. I literally thought that we produced eggs like all the time, like every second.
Now I swear we might have talked about it.
No, listen, we may very well have, but don't put that on. They put that on me. But and I think to Wendy's point, what she just said, she said you ovulate them once, and I was like, oh, okay, yeah, that makes sense. But
it goes back to good information. So sometimes that information, it should have enough time, unfortunately, probably to do a podcast and blast this information. So challenging your providers to ask questions, like using those gynecology appointments when you're talking about reproductive health, to ask these questions of like, realistically, what should I be thinking? So I had a 39-year-old sitting in my office last week, and she's like, yeah, I think we'll be ready in a couple of years. I have
a 50-year-old that's trying to freeze eggs, and it's just like, well, see, we have failed you. Because no one to this point has ever prepared you that we're not it starts in our schools, it starts in our families. It's just really important for us to know these basic things about our bodies that I did not learn from my family. I learned them because I went through 3 years of fertility treatments, but that's not what our patients are supposed to do, right? So we really have to start this education early, not just, let's prevent pregnancy with birth control, but like the reproductive health and reproductive aspects of, our lives, as we matriculate through life. At 18, you're not trying to get pregnant, but at some point we should know we're born with these eggs.
But I think to what you just said is so profound. I would say with my generation, I don't know what letter we are because they give us Z, X, Y. I don't know where we are.
Oh, we sure not Y. I don't know. I'm never going to take Z.
I don't know who we are, but this group that I'm with, it was, the whole focus was don't get pregnant.
Yes.
That was like beat down into us everything. Don't get pregnant. When you go to college, don't get pregnant. In high school, don't get pregnant. That was the only focus is don't get pregnant, right? And I think so many, and then in the same era, this is a group of women where the birth control was pushed down our throats. Like every time you went to the doctor, like, my knee hurt, you on birth control? I'm like, I'm not even here for this. It was the conversation all the time, to where now it was like so far out of my mind of getting pregnant because the focus was don't get pregnant, do this, do everything you want to do first, don't get pregnant, whatever. And now you're trying to get pregnant, and it's not just myself, but so many of my other friends are in this same group where we're 36 and over, and everybody's having, well, have you heard about this? Did you do that? And we're, like you said, with brunch, we're sharing information amongst ourselves based off of what we're hearing from our doctors, what we're learning, experiencing. But many of us are also not having those conversations with our girlfriends, because I have one girlfriend, she's gone through a couple of rounds of IVF. She didn't tell any of us because she was ashamed.
Yep.
And I'm like, do you not think that we'll be there to support you? And I didn't even think about it. She said, I am the only one in the circle that had to go through this. Everybody else was normal. She said, so I'm thinking, what's wrong with me?
Yeah.
And I didn't feel like it was a space for us to have that conversation. And it wasn't until she said it that I thought it, because I never thought about it any differently. I was more interested in her journey than some of the others because it was so different, but not understanding that's how she felt.
I think it's because, one thing in like womanhood is it's supposed to be ingrained that this is something we're supposed to do. Like this is, where that's never been my paradigm. Like I'm supposed to do other things, and the reproductive stuff is just, like don't get pregnant. But the shame comes in where we're really, this is why we're supposed to be put on this earth. That's how some people think. That's a religious thought. That's just kind of what some people are taught. And then when you can't do that, you can't do that for your family, your lineage, your husband, and all that stuff. It's such a weight. And then you feel isolated and you feel alone. And so, we do have to create space and hold space. Sometimes you just ask people, like, when are you gonna have a baby? It's like, child, I've been trying for 10 years.
You don't even know. Like, it's worse.
But it's like, it's the way we ask. It's the way we hold space. It's the way we, you're not even trying to be rude when you're asking. it, but it can be very hurtful when you don't understand the nuances of life. It becomes hard. Getting pregnant in your 30s, not everyone just, the first month it happens, right? And we just have to have those conversations like this so that we know how to communicate and how to make sure that our friends who may be going through something know that no matter what, they can talk to us, even if it wasn't our journey, because we have that empathy in us.
And I think the other piece too is because it is not a common conversation that happens at brunch. I like to liken it to, having an abnormal pap smear. Like nobody sits down and is like, "Oh, girl, did you have like was your
Right.
HPV?" Yeah, it doesn't come up. So the same way with their miscarriages. You don't know that someone's had 2 miscarriages. You just, she puts on her happy face. She comes to brunch. She's like toasting, having a good time, telling jokes. But who knows, 2 weeks ago, she could have been, following her HCG levels back to normal. So same thing with the fertility journey. So I think sometimes we just don't know what people have done, which is why, when it comes to my friends, I am the last one to ever ask someone, when are you having babies? Are you interested in it? You'll let me know because I will see that you are having a baby shower or I see your baby bump and congratulations then. So I think we have to, as friends, as family members, be careful when we're talking to our female relatives, our female friends, our colleagues, putting that expectation on them because it could very much be their heart's desire and they're just having difficulty. And I think we don't always appreciate how common miscarriages are. 20% of pregnancies in a miscarriage. That's 1 in 5. If you have enough pregnancies, you will have a miscarriage statistically. And so it's unfortunate when it's your first pregnancy or your second pregnancy, that's how you start that experience of your reproductive space, but they're very common, and so a lot of ladies, and like you said, don't really talk about it often, but a lot of them are going through some of the same experiences in parallel.
Yeah, I think too, we have topics that are I won't say trendy, but maybe more popular than other ones when we think about it, right? So typically, outside of egg retrieval, having the baby, the only other thing I've been hearing really is around fibroids, like this conversation around fibroids, right? And Black women and fibroids. And even that wasn't something that we knew. I had my roommate in college, remember like it was yesterday, we were in the room getting dressed, we were getting ready to go to the club. Like we was outside, right? And she's on the volleyball team. So she's my friend, she's like 6'1". And we just hear a boom. And we all run to the room and she is just screaming in like excruciating pain. And we have no idea what's going on with her because we're 18, 19 children. We don't see anything. And she's just holding her stomach doubled over, just screaming. And so we're like, maybe something happened in practice. We don't know. And so we call them out and she goes to the hospital. And that's the first time I heard the F word of fibroids. And it was like she had a ruptured, whatever. Her parents had to fly and she had her surgery, a whole big thing. And we're just like, what does that even mean? Like, what is that like? And so even then, it was not something we heard or talked about until we experienced her going through it. And so now when we're going through these pieces, I see a lot around fibroids and these pieces, but not necessarily the connective tissue like you guys are kind of weaving together how these things kind of operate within the same space.
And it's crazy because upwards of 90% of us as women of color will have fibroids.
Right.
But really, we don't talk about it like it's that common.
At all.
Which in families and, that is crazy to me. And it's intertwined because fertility, maternal outcomes, fibroids are linked in all of that too.
Yeah. And I enjoy reality TV for the outside of the craziness, the nuggets, right? So I was a huge Atlanta fan, and Cynthia was the first person I saw talking about it on hers. And then this last season of Potomac, Giselle was talking about it in terms of hers. And now we're back on Atlanta, and Sheree talks. The only thing is I wish it went deeper because it just goes like bloop, and then they just move on to the next fight or whatever.
They got to fight now. I love reality TV. I need a little fight. And I don't have fights in my personal life. So I like it on my TV. I get it. But yes, we do need to delve in deeper because that's where a lot of people get information or say, let me Google this.
Yeah. So before we dig into that, I'm going to take us to a quick commercial break, and then I'm going to come back when I'm asked you, like, what exactly is a fibroid and how can that affect maternal health when we start talking about pregnancies and things as well?
Sounds good.
So we are back, and I am your host, Jessica Taylor, with the OffScript Podcast. And today we are talking about egg retrieval, Black maternal health, and then more importantly, what does this look like as you're planning for family planning? As a cast member of Ready to Love Dallas Season 8, I discussed my egg retrieval journey on the show, and I thought that it would only be perfect for me to bring my OBGYN, Dr. Wendy Parnell, and fertility doctor, Dr. Tiffany Jones, to dispel some myths that we hear around family planning, and then also really get into the insights of how we should best prepare for the journey that we have going forward. Alrighty, Dr. Parnell,
Yes.
fibroids. We were talking about them right before break, but what are fibroids? Like, what are they? How do they impact pregnancy? What does it look like? The whole spiel.
Yeah. So fibroids, they're very common. So our uterus is made up of different layers. You have that thin lining on the inside. We call that your endometrium. Then you have this thicker layer, which is the muscle of the uterus, the myometrium. And you have like a little sheet or serosa that's on the top of the uterus.
Okay.
So fibroids are tumors or masses. So majority are benign, but they're tumors that come from that muscle wall layer of the uterus. So they have the same receptors that the rest of the uterus has, but in higher concentration. So just by having your own menstrual cycle, not necessarily hormones or anything that way, just a natural cycle over the course of the month causes those receptors to also, as hormones get released, those receptors get activated in that tumor, and over time they can slowly grow. So all fibroids are not created equal. Some fibroids can be the size of a mustard seed, and some can be the size of a grapefruit. Some fibroids can sit right up against the lining of the uterus and cause lots of heavy bleeding, and some can be sitting at the top of the uterus like a broccoli stalk and just give you pelvic pain. So there's a lot of varying symptoms that can come from fibroids. The one that we think most commonly is bleeding. So typically you'll have a lot heavier bleeding with clotting, oftentimes can cause pelvic pain. So you can think of having a grapefruit sitting on your pelvis. That can be uncomfortable with the cycle on a daily basis, with intercourse. So that can be an issue. And kind of weaving into our conversation today can also impact our fertility. So that cavity has the opening to your fallopian tube. So we get pregnant actually in our fallopian tube. So if there's a big fibroid keeping that sperm from being able to make its way to the fallopian tube, well, that doesn't mean that your ovarian reserve, your AMH could be great, but that itself could lead to infertility just because of a structural blockage from that fibroid. And so sometimes that's the treatment. Sometimes that's all patients need. They've seen and done this wonderful workup with Dr. Jones, and they've said, okay, you have fibroids. You need to go back to your gynecologist to have those removed. And you probably won't even have to come back to see me because that's probably all that it is, and can just kind of start trying to conceive on your own. So not every fibroid needs to come out prior to pregnancy. There's plenty of patients that can spontaneously conceive with fibroids in. We do, in those pregnancies, like to monitor the growth of baby, because like we said, there's a lot of blood flow that goes to these fibroids into the uterus, and we don't want it to compete with that blood flow to baby. So we typically will do growth ultrasounds every 4 weeks or so to make sure that baby is still growing appropriately. Patients can still have vaginal deliveries. So sometimes they feel like if I have fibroids, that means I have to have a C-section. Now, if you've had a very invasive fibroid surgery, then you likely will need to have a C-section. But if you spontaneously conceived and the fibroids are there and they can all live happily together inside that uterus and grow a healthy baby, then you can continue to have a vaginal delivery. So fibroids are very common. I don't want patients to be afraid if they have fibroids. Not all fibroids need surgery, but it's good to know what's going on in your body. And so an ultrasound is typically going to be the best way for us to diagnose fibroids if you're having some of those symptoms that we were just talking about.
So you can have more than one?
You can. So like I said, when we do these fibroid surgeries, we do different imaging beforehand. So we can get an ultrasound, we can get an MRI, and those can help to give us an idea of how many are there. But I can tell you, every time I've done a myomectomy, I always find more at the time of myomectomy than I've seen on imaging. So you can have a lot of fibroids inside the uterus, or it can just be one big one that's just causing a lot of drama.
And is there a time where your body might produce? Is there a time where you might see women who have more fibroids? Like I typically see women over 35 have more, or is it just kind of vary just based on the
Well,
person?
It goes back to that hormone production piece, right? So you typically could very well have fibroids in your 20, but not a lot of them are very impactful. Not a lot of them can I really feel when I'm doing your pelvic exam. They typically present and cause more issue as you get into your 30s and your 40s because they're bigger and doing, causing more havoc. So that's the reason you hear about them more when patients are getting older, but a lot of young patients may have them too. Now, if you have really big symptomatic fibroids at 25, it's probably not going to be a good journey for you because you're probably going to have to deal with those over the course of your reproductive years, potentially multiple myomectomies if fertility is an issue. Yeah. So having more impactful ones when you're younger doesn't always bid well, but happens.
Wow. And is there a reason why we typically hear that Black women experience or have more fibroid issues than other groups?
So there's definitely a genetic component because you will see that they will kind of cluster in families. And my grandma had fibroids, and all my aunties had fibroids, and hysterectomies. So we will see that, but there are all definitely some, external things and factors. So in terms of our nutrition and our lifestyles, it can impact the growth of fibroids. So doing a more plant-based diet, doing, more greens and leafy vegetables, avoiding a lot of the processed foods, that can help, not necessarily to dissolve them. We're not going to make them disappear, but our goal is just to kind of slow down that rate of growth. And their impact and some of the symptoms that can come about from the fibroids. But we do see them more commonly in Black women. Just another thing.
Another thing. Can't we just be?
Some people have linked vitamin D deficiency. And because as women of color, we block vitamin D production, hopefully that will become something more of a mainstay for prevention and an easier tool to replete our vitamin D levels.
Really?
So this beautiful brown skin.
Yeah.
But it does block vitamin D.
And it was so funny when my general care physician, my primary care, and he said, he's the one to get on the blood work. He's like, you have vitamin D deficiency, like take these and eat these. I really try to stay off as many meds as possible. Like I'll eat more bananas or whatever it is I need to do to get it.
Just go outside on a walk.
I don't know if bananas gonna get it.
Yeah, whatever it is. But I just but that was a lot of it too. Yeah. And I noticed it, guess when I was getting it? During COVID, right? Yeah. So I'm sitting up in the house all day long. I'm not going outside. The few times I do go outside is to check the mail and come back in, right? And I didn't even realize it, right? And so I was like, okay, maybe I need to add some more things into like my morning diet, vitamins that can give me these things, but I didn't even think about it. And I don't think we also think about the amount of things that go into having a healthy retrieval or even just having a healthy pregnancy, right? I think it's like, I'm fine, I feel fine. Everything
look good on the outside.
Yeah, look good. Everything should work into it. So with this conversation, I think it's so important to know the amount of different things that you have to think about and consider when you're deciding to go into this space.
It's just like, I think of it as a relationship. You can't be like, okay, I want to be in a relationship now, and you haven't dealt with previous trauma, you haven't, truly gotten over your ex and all these things. So we can't just go into pregnancy because I just want to be pregnant,
Not the temple rub.
Right. Yeah, talk about it.
Listen.
So just because you want to be pregnant in that moment doesn't mean that you're necessarily ready to be pregnant. And sometimes that's a hard conversation to have, with patients. I'm like, I need you to do a lot more things before I can bless your pregnancy. Now, if you get pregnant, we will get you through it. But this could be a much smoother journey for the both of us, particularly for you, if we can do some very proactive things because we're actually planning. If you came up pregnant, okay, we're here now, but we can plan it. Like, I need you to get this blood pressure under control. We may need to change out your medications. If you're diabetic, let's see how we can get you, your weight down, your A1C into a good range. All these things cannot, be taken lightly. So just because you can get pregnant and you have a positive pregnancy test does not mean that you necessarily should. So I think we approach it just like we would approach any other, major life decision. If you can plan and enter that as healthily as possible, then let's do that. And so that's one of the things, like, I really would love to see us as a community. Yeah. And I think that would truly help our mortality rates, just looking at how healthily we go into pregnancy. Now, this is not to neglect the disparities and the lack of care that a lot of our ladies are getting in pregnancy. So I'm not minimizing that. But then I always like to look at the whole plate. Like, I'm not going to just focus on this big, huge entree, but what are the appetizers, the other components in this meal that maybe we could impact?
We can control.
And so, we just are truly an unhealthier population. If you go like bit by bit, we end up with obesity, a lot of comorbidities. And so that's what we can do as Black women to help prepare ourselves and protect ourselves so that we can hopefully avoid any of those situations where they're having to aggressively manage my blood pressure because I did the best I could to get my blood pressure under control before I got to pregnancy, and hopefully I never become preeclamptic and have to rely on them to manage my preeclampsia
and not miss it.
More importantly, not even miss the preeclampsia altogether. So that would be, one way I would consider what we can do. I know we can't, it's an overhaul of the entire healthcare system and the teaching of, mid-level providers, the attendings and things that way to recognize and truly appreciate that we have a problem and the inequities in healthcare. But I think for us, what we can do is improve our health going into pregnancy.
Yeah, I was going to say, we don't utilize the preconception time, right? It's just like most people, they just get pregnant, right? And then it's like we're chasing everything. But preconception, like planning to do this. You know, we go to the OB, we get our pap smears, we get our breast exams, we talk about, you know, any symptoms that we're having. But like, who schedules a preconception to say, hey, I'm thinking about getting pregnant, not I've been trying for a year and I didn't get pregnant? Because then it's like we've missed an opportunity, and it's just really never been like the primary care aspect of OB wasn't really developed as well, at least that conversation with patients, to know that that is something that's truly important before you start that walk.
Yeah. And it warrants a full conversation. You know, I think sometimes we're like, oh, I had my annual exam. I'm sure she would have told me at that point.
It's like, oh, we got 15 minutes. That's the pap smear. That's all you get.
So that's not always the best time to try to get all the information that we have to share. So whether it's a televisit or just making another consultation, to really get that information from your provider before you go into pregnancy can be so valuable.
I love the point that you talked about getting yourself prepared, because I think a lot of times we just go into things, even we just talk about relationships, going into things and just, I have these things together, right? And it's so funny because going through this experiment is what they call it, with Ready to Love, I learned a lot about myself. I learned about dating, a lot about dating more, because I wasn't doing that much to begin with. So, you know, more. But I think one thing too is understanding what's important and what's not, right? So I say this to say, you're saying getting yourself together. Me getting myself together was, I'm financially stable. I'm in a good place in my career. All of the other things, right, that go outside, because you want the baby to be raised and blessed in a beautiful space and have a happy life. So I was focused on all of those things, right? And then there's also get your spirit together, you know, the focus on that. Getting your health together was kind of like number 4 on my list.
Because,
you know, I'm like,
I turn the page over.
You know, I'm like, I eat pretty good. Okay, I may not order out as much, but you know, whatever. But I think the one thing, and I'll just be very honest and transparent in this space, is mental.
Yeah.
Getting your mental together. So for those who have watched the show, you will see that I talk about my egg retrieval journey, wanting to do this at the time. And now that I think back on it, being in the best space mentally is just as important as being in the best space health-wise and financial-wise and spiritually when you're going into this. Because if I had to do this again, I probably wouldn't have did this retrieval when I did it, right? So we filmed the show was over. So I'm like, okay, great. The heavy stress of what I was concerned about is over. You know, my life is back regulated. I'm not smiling for 12 hours a day, asking folk, what's your favorite food? Where your family from? Like, oh, Jesus, right? I'm past that. I never thought about the aftermath of watching it and reliving it all back, right? And so I was going through this journey with Dr. Jones, and she's coaching me through it. I'm like, okay, I'm ready to do it. And I decided, okay, I'm gonna do my retrieval now, because this is a slow part of my business. The show is on. It can't be that bad.
It's bad.
It has been the roughest thing I have been through, like, ever. I won't say ever, but it's like up there with my mama's death. Like, it's been that stressful. Like, I've lost so much weight, and then just trying to do this and still keep maintain a healthy mental space, when every time I pick up my phone, it's a text or a tweet. Did you see this? Did you see that? People are tagging you in things, comments. So you're just getting flooded with all this negativity and stuff from all over the place. And you're still trying to go out and show up in a certain way, when people have also edited you to look a different way to 200 million people, whoever's watching this, that you don't know, you know? And it's like,
I have an opinion.
Right? Yeah. And it's like, oh my God, that's not me. I didn't say that. I did roll my eyes, but not right there. Not right where you put it, you know? I'm not mean. I just, and so it's just like all of this. And so hindsight being 2020, Dr. Jones and I was talking last week, and she was like, this was not a good process for you. This was not a good retrieval. It didn't work out the way. And while those words like hit me like a ton of bricks, because I was on my way out and I was like, I just can't. I just laid in the bed and just cried for a while. I was like, I just got to get this off of me. I'm thankful because I'm one of those kind of see it through people. Mm-hmm. I would have walked all the way through it. Yeah. And then on the back end been upset that maybe none of these fertilized, because with the stress I've been under, them eggs was probably wouldn't have been worth a good god doggone, right? Like they would have been worth nobody's glory. But at the same time sometimes I feel God has to step in because we're not able to step in for ourselves and have to shut stuff down and say, not no.
Just not now.
Not right now.
Yeah.
Yep.
We need to pivot and get you to a better space to where I can actually show up and give you the desires of your heart. Because right where you're going, you're not going to be happy with me. You're not going to be happy with yourself. You're not going to be with anybody, because it's going to be, it failed me. When it didn't fail you, you just were not in the best space.
Yeah, I think there's never a perfect time for a lot of things. There's never a perfect time, but there's some times that are just not good times.
Exactly.
Bad time, So there's never, in reality for pregnancy, there's never a perfect time for pregnancy. You could always have more money. You could always have a bigger house. You could always have, better work-life balance. There's never a perfect time, but there's some times that are better than others. Like if I'm, housing challenged and, without any income, like, okay, maybe that's not a good time. But there's definitely times that are just not good. And so what you're describing, it seems like that was just a time from a mental health and physical health. I mean, and imagine just those hours that you're putting into your business and the show and the things that way, your body doesn't have the rest and all. It needs to be in a very low stress mode to be able to go through retrieval. You're growing a lot of eggs and developing a lot of eggs at one time.
Yeah. And it's too, and then too, you're, at the same time for me, I was like, when I went back and I was like, hey, because I'm a reflector. I like to sit back and say, what could I have done different? When you're stressed, when I stress, I don't eat as much. So I'm not eating as much as I normally. So all of these things are factoring in. So when I got it, I was like, you know what? When they say, though they slay me yet I trust them, it was like, though this didn't work out how I wanted it to, I'm still okay with the outcome of what's happened thus far.
Yeah.
So Dr. Jones, I wanted you to talk a little bit about a crash retrieval or one that doesn't go so well.
Yeah. So when we're taking these medications, right? Usually our body produces enough hormones to give us 1 egg a month, okay? But as we talked about, the more eggs you have, the better your success rates are going to be. And so I have to give people hormones to kind of cultivate the growth of all of them. But if we don't have enough, right, if we miss doses, if, things happen, taking them at a later time than prescribed, then they won't have enough support. And then the cycle will kind of stall out. And then it's really hard to rescue that. And the issue is, once you go, like I always tell patients, the most expensive part of this process is the egg retrieval and the embryology part, okay? The ultrasounds, they add up. The medications are really expensive. But once you have to do the surgical center fees, the anesthesia fees, the actual egg freezing fees and things like that, we have to get you to that point in a way where we don't look back and say, I wish I would have redid this at a different time so I could get more eggs, right?
Yeah.
Because I know when we start what the goal is. We always try to map that out. And so if I think we can get 25 eggs and we got 2 growing, we need to stop. We're not on the right track. And there's a lot of factors that can play in to it, especially when you're doing it at a time where it's just, life is too hectic. This is an insult to your schedule, right? Like this is not your normal thing. Nobody sees Dr. Jones every other day, right? Like that's not normal to your schedule, but that's what's required. Medications every day. If you're traveling, all that, it's just so much. So you have to have time to get this process done. And yes, it's a 2-week time commitment that doesn't seem like it's a lot, but when you're super, super busy, like I don't take injections every morning. That's not my norm. And so it's easy to know that if you're not in a place where you have a little bit of calm, you'll forget. And then if we don't get to those, to cultivate what we're trying to get, I just can't move forward with less than what we were going to expect, because 2 eggs is going to give you a 0% chance. And why spend that type of coinage when on a 0%, So I really want to give people the best
outcome. I remember my process, and this is my personal journey. I mean, you're busy OBGYN, you've got clinic, you've got OR. And like you said, you have to stay to the schedule of these medicines. And so I had to pick a time that I knew I would always for sure be able to do my morning and my evening. And I got, similar to you, I got kind of mid-cycle, and my REI, who was not Dr. Jones because she wasn't even in Dallas yet, but she called me, she's like, Wendy, I don't know, like the sono today. I mean, it looks okay, but we may not really be able to go forth with it. And like, it just took my breath away. I think I just stopped hearing anything that she said. I was like, well, I did all the things. I did my medicine like you told me to. And I'm getting my rest. I took my vitamin D. I've got all the things. And so it was devastating. I'm like, I was with you. I was like, I don't think I can do this again. And I was not even to the point of having the anesthesia and going, like, I was just to the point of like starting the more intense injections. And I was, I don't think I can do this again. Like it seemed very lonely because I was single at the time. So I was going through this process by myself. I'm like, what am I doing to my body? And so thankfully, by the grace of God, like mine kind of came along, and we'd already talked through what we were going to do differently in the next round, in the next protocol, and how we're going to redose the medicines. But thankfully we were able to get through the process, and I was able to go through the retrieval. But I know exactly where you're from, that devastation of like, how could I do this ever again when I've just already put so much on my body and strained myself emotionally and mentally and physically,
financially.
Come on to the coin.
More medicines, another round equals, like you said, more coins and more expensive medicine. So it does. It's a lot. And you don't really know what to anticipate. And you can read all the books, you can be on the blogs, you can talk to your doctor, but until you're going through it, you just can't really grasp exactly what that feels like.
And the two in that same space is just kind of like another blow. You know what I'm saying? Because then, I don't know about you guys, I feel like when something negative happens, my mind goes into all the other negative things that are happening too. Yeah. So it's just like you said, you're single. It's like, and I'm still single. And I got to do this. You know, like everything is just falling apart. The whole world's going to hell. And so it's just like.
Gained 10 pounds.
No, and not even that. I lost it.
I did not.
So the thing now is, none of my clothes fit. So I literally spoke on a panel, y'all, the other day for Startup Week. And I had a hair bow around my waist and my pants. And then I had to slip them down because I lost that much weight.
Girl, don't nobody want to hear about all that, child.
No.
Okay. Don't nobody want to hear about your. Oh my goodness, my pants are just way too big.
Feel terrible. Feel terrible.
Tacos after.
Wendy knows because I've struggled with weight all the time. It's so funny because most people struggle to lose weight.
Exactly.
Right. And for me, I've always, since I've been little, have been in a struggle to gain weight and to maintain gained weight. Right. So that's the biggest thing. Because I remember when I was working at Toyota, and this is going to sound crazy, but it's the truth. And I finally got to a size 2. Y'all, I walked around that building. I walked around that building and made sure everybody saw me. Listen, I bought leggings because now I don't look weird with leggings on. I was so proud.
She's I think it's Glorilla.
Yes.
Just swear I'm thick. I said,
that used to be me. I used to have to tell myself that. Like,
sit down.
I have to tell myself that because and I'd be like, well, even my family, right? Like we line up and take family reunion pictures, and my cousins, boobs, but Jessica, the rest of them, Aisha. And it was just always So it was always because too, going to family stuff. My aunts on my dad's side are always here. You need to eat more. You need because it's a constant conversation. You know what I'm saying? I'm just like, shut up. Just let me struggle with this on my own, right? So the fact that even with this journey, I was thinking like everything I could have done wrong, but I was defeated and I was feeling bad about it. And I was like, okay, I got to get back into the text. I got to get back on my phone. My good girlfriends who were kind of encouraging me to do this again. But this just wasn't the time. It started out being okay, but as the show progressed in episodes, I was like, these people are kind of crazy and they are mean. Like,
and they work in my nerves.
How do you find me? Like, I have like the lamest profile. Like, why are you following me? It's so like, I was like, sometimes you just need to step away from some things and come back to it. So I'm not team no retrieval. We gonna do this. Okay. We gonna do this, and it's gonna be good, and they're gonna be flowing, and it's gonna be all the things, but just not right now.
Yeah. It's an art. It's a science. Like it's not a one size fits all.
Exactly.
So, it's like birth control. I can't give everybody the same birth control pill. I can't give everybody the same birth control. Sometimes I have one that I think would be a good fit for you, and it's just not. So it wasn't a fault of your body or a fault on the recommendation. It's just it didn't work out. So I think that's the piece to have too, because we sometimes with miscarriages, with failed IVF cycles, like, oh, what did I do? What could I have done wrong? What did we miss? I'm like, there was nothing missed. There was nothing that was missed. It just wasn't your time. This was not the embryo. Like this was not it. And so I think just having that acceptance and being able to bring closure to that and say, okay, this was not my time, and not to keep going back to it, but to release that and say, I'll get there. It's just to what you said. it's just not right now, but I will do this process and I will be successful. And same thing with,
It's gonna work.
pregnancy.
I mean, because I'm just gonna keep calling y'all. Like, we're gonna figure this out.
We're going to keep answering. We'll keep answering.
And you may never need those eggs, okay? You
Listen,
may never need them.
I'm right behind Wendy. You know what I'm saying? I'm just like, I'm like in the alphabet is P and then T. So that means the blessing just coming on down the road. He just left our house. He on his way to mine. So I'm just gonna set the atmosphere. I'm just gonna be in the lining. You know what I'm saying? I'm just gonna be in the number. That's what I'm just gonna be in the spaces. So when her they come be at the reception, like,
Okay, catch that bouquet.
now I ain't catching. I'm like, who is here? Who is here now?
Let's just say be ready to receive it, because it does becomes very unexpected, and it moves very quickly. You know, once it's that right person, and it feels right, and you just have to be ready to receive it, because it just rolls, and here we are. You know. And
also, my friend that said, when God moves, because he's even said he does it suddenly.
Yes,
it's not a whole lot of back and forth, and when it's right, it falls into place. And anything that I tried to do, like even starting Ezra, whatever, it happened easy, and it was quick. And I said, and that's how I want it to be, easy. So when I meet this guy and it's too much of this back and forth in the first,
that ain't it.
This ain't supposed to be super easy.
Yeah, we're supposed to just be like, oh my God, your eyebrows, like, we're supposed to be just wrapped in shit. Right now, you're stressing me, and this is too soon to be stressed. I don't even know what you like to eat. So I can't cook you nothing, no way, but I still would like to know
what I should pick up.
What I should order. Okay, so we're coming to the end of the segment. So I do have like a little round for you guys. It's a myth versus fact. So I'm gonna ask you a question, and you just tell me if it's myth or fact, and then feel free to expound upon it if you want to.
Okay.
All right. Ovarian stimulation causes cancer. And y'all know I got these off the internet, right? So yeah. So ovarian stimulation causes cancer.
False.
This is for you. Okay.
Oh yeah.
False.
Say it too.
False. So what people who do repeated like IVF or egg retrievals can be at higher risk, and the risk is still less than 1%, are things called borderline tumors that aren't cancers. But I think because when you're doing an egg retrieval, when you're taking those hormones, you're increasing your body's natural estrogen. And we do know that there are some tumors like breast cancer that can be stimulated. Or people always ask me, are my fibroids going to grow? No, they're not going to grow, because you're only going to be on these medications for 2 weeks. But this is how these myths kind of come into play, because your natural estrogen does increase, and estrogen is linked to some cancers. So then people would extrapolate to say that, oh, it's going to increase my cancer risk. But cancers do occur. It doesn't increase the risk.
Cool beans. You have anything?
No, I absolutely agree.
Gynecologists only monitor vaginal and breast health.
I would say that's a false myth statement. We try to keep you well in your entire body. Like, we absolutely are, focused and trained on pelvic health and things that way. But we want to talk about breast health and your overall wellness. We talk about your blood pressure, your weight. So although, you've got certain guidelines now that suggest you don't necessarily need a pap test every year, I would still think there's benefit to seeing your provider annually to talk about a lot of things we just talked about what are my fibroids doing? What is my reproductive plan? Have I done a breast check? Have we talked about the appropriate screening and lab testing and AMH level that needs to be done? So I think there's still benefit to using your OBGYN as a wellness provider beyond just your breast exam and your pelvic exam.
Cool beans. Egg extraction affects reproductive health going forward.
No. So that is a myth. Okay. And I mean, I can understand why people come to that conclusion, because it's like, oh, Dr. Jones took 25 of my eggs, so I'm going to go into menopause sooner. No, girl, that's not how it works. What happens is we have maybe, depending on where you are in your life, your age, you may lose 20 to 30 eggs a month. This is why we're born with millions, right? You don't lose just one, you ovulate one. So you release one. That's why most people are pregnant with a singleton or one baby at a time. The other 29 or, whatever it is, they die, and then a new set come. So what we do for an egg retrieval is we rescue those that would have died. Now, some of them still would never lead to a live birth. That's why the success rates aren't 1-to-1, but a lot of them can lead to a live birth, especially in a younger person. So that's why we can rescue them. But no, if I take out 25 eggs, you're not going to have 25 less periods. Not at all.
Dang.
It's a lie. Okay, I don't like most people
Dang.
like that, but no, it's a lie.
And to piggyback on that, the same is true for birth control, as my gynecology
Oh,
hat
my
on.
goodness.
So just because you're on birth control, that does not mean that you have preserved your fertility because you're not ovulating these eggs. They are still dying off at that same rate as they would have if you were ovulating each month.
Oh, okay. All right. Egg freezing ensures a woman can have children later in life.
Unfortunately, that is also false. It is not a guarantee. And that is no matter who your fertility doctor is, you can't oversell or entice these things. It is a great tool, but by no means is it 100%. I think most calculators don't go above like 80% for success rates for any age group, for any woman. So no, it is not a guarantee. But for those who are waiting to have children and they know they're going to wait later on in life, it's definitely a tool that may help some people.
And it is not necessary for me to go see my gynecologist every year.
I would say that's false, kind of to that same point we were talking about earlier.
It is. It was false. Well, ladies, I appreciate you guys so much for taking time out of your uber busy schedules to come sit with me on the little yellow chairs.
They're beautiful.
Thank you. Don't you like us look a little
It's
vibrant?
not yellow, it's my color too. I love the yellow.
But no, seriously, I appreciate you guys coming through and just really being able to help dispel some things that we've been hearing around it, talk about the importance of egg retrieval and also maternal health and fibroids, and joining me and supporting me along my journeys of being my doctors as well. So I just wanted to tell you guys thank you for being here today.
Your transparency and just having the conversation, and opening up and sharing your health story and your journey to maybe help someone else.
All the time. I'll tell her, I'm like, let me tell you, girl. Let me tell you how you brought me over. So with that said, we're wrapping up. Thank you guys for joining the OffScript Podcast. I'm your host, Jessica Taylor. That's all for this week, and we'll see you guys next week.